Inside the Huddle, presented by the HealthBite Center. Mark Elfenbein, Tony Dorsett, and we're being joined now by the man, Dr. Ramsey Fanous. Thanks for being here.
Thank you, Mark.
We really appreciate it. All right, so HealthBite Center, very, very successful. How long have you been an oral and maxillofacial surgeon? How long have you been doing this?
I've been doing this for 21 years. Been doing it for a long time. I love it. I enjoy it. Practiced in Dallas for 20 years, and last year we purchased a practice in Lubbock.
Wonderful.
So we practice in Lubbock, and we also practice in Dallas.
How long did you teach oral surgery at Baylor?
I taught from 1997 to about 2012.
And what did that help you in terms of taking the next step?
You know, the guys are always smarter than you are. You know, they really are. And it keeps you up to speed. You always have to study to stay ahead of the younger guys. And it seems they always get smarter by the year.
In terms of being important to be board certified as an oral surgeon and to do implants these days, which are so important for people going forward because it's changing their lives. Talk about that.
You know, board certification, just to be clear, the training is the same. Everybody gets the same training. To be board certified, for me personally, I took an extra step to ensure the quality of care my patients get. And like Tony said, you always want to be the best. And for us to be the best, you know, you take that extra 2 years, we get tested rigorously by our peers on all aspects of the specialty, implants being one of them. So, you know, as a patient, as a consumer, when you look, you know, you could go to a non-board certified or a board certified surgeon, regardless of what you do, regardless of the specialty. It could be sports medicine, orthopedics, internal medicine, and then you make a decision whether you go to a board certified or a non-board certified.
What kind of sports injuries have you treated thus far in your career, or things that you do?
You know, it's seasonal. With sports injuries, it's more of facial trauma, which is part of what we do. During the fall, obviously, it's football. With football, we see jaw fractures. We don't see as many dental trauma because they do wear mouthpieces. During hockey season, we see a lot of trauma. A lot of trauma to the mouth, the teeth, cheekbones, jaws. Basketball, you'll see a lot of orbits, eye sockets, cheekbones, and nose. And then you get to the baseball season in the spring, and that brings on a different slew of trauma.
So like the elbow to the cheek injury is different than the baseball to the cheek.
Exactly. Baseball to the cheek is a lot different than the elbow.
You already
to
have the
cheek.
stitches already in there.
Exactly.
Are there any preventative tips, Dr. Fanous, that you can kind of offer out there regarding oral health or avoiding sports injuries for people?
You know, as far as sports injuries, for kids playing sports, number one thing is a mouth guard based on what we see. If kids wear braces, wear a mouth guard regardless of the sport that you do. It really helps protect the teeth and the mouth. Hockey players, they hate this, but a shield would be so wonderful. But if you talk to them, they don't like that.
No, you got to be macho.
Exactly.
So for people that want to get a hold of Dr. Ramsey Fanous, what's the best way?
You could call the HealthBite Center, 1-800 number, and then they will direct you to either the West Texas area or the North Texas area.
Ladies and gentlemen, the one and only Dr. Ramsey Fanous.
Thanks, Mark. Appreciate it.
Of the HealthBite Center.